Okay.
Hi, my jacket says See Jane Think, and I'm Jane. Jane Sarasohn-Kahn, health economist, management consultant with Think Health, and I write the Health Populi blog almost every day when I can. The question is, what is Health 2.0 to me? Health 2.0 is the ability to leverage the social web for health applications for all stakeholders in the health ecosystem. First, centrally, patients / consumers / caregivers, health citizens, and then around that health citizen consumer, all the other stakeholders in care. So, the doctor, the hospital, other kinds of care settings and providers. Pharma is a key stakeholder in health. Payers, plan sponsors, employers, unions, any organization and stakeholder that has a hand in health. And increasingly, I'm listening to Surgeon General Regina Benjamin, who says health is where we live, work, play, and pray. So I think about food systems as part of the health ecosystem that can leverage that. And we saw that today in Health 2.0 with the Foodjucate app that the Phillips family uses. And we have to think about transportation systems and urban planning. So it's everything that shapes health that leverages the social web, especially to empower patients. That's Health 2.0 to me.
Excellent. And what are you doing to promote the liberation of health data?
Okay. So to promote the liberation of health data, I'm doing several things. First, as a blogger, I blog at healthpopuli.com, and the goal of my blog is to look at the intersection of people, technology, and health, and bring transparency to a really screwed up health system, which is what's in the United States. So we want to tell people about their data rights, their access to health information, and in Health Populi we talk a lot about people's use of health information, what the barriers are to using it, health literacy, health plan literacy, health system literacy, and we can only have data liberation when patients and providers come together and co-engage, co-create health, and put data together. So the other way we liberate data is to free the data that's within ourselves, not just the data that institutions capture about us. So that means we have to pay attention to our observations of daily living, which is what Robert Wood Johnson tells us to call things like our toileting habits, our sex habits, our moods, what we eat, how much we move around, our moods. Those observations of daily living are at least as valuable as what comes out of a lab test, a mammography test, a PSA. We want to marry that data and then have wonderfully usable, fun, engaging interfaces to get the data out and then use it to make decisions on, particularly connected decisions with our provider. If you can connect in a 360-degree way, we can have better health outcomes through liberating the data and empower people on a daily basis to make great micro decisions.